For our NUR 2106 assignment, we chose our patient condition to be ARDS, Acute Respiratory Distress Syndrome. My name is Alicia, this is Emily, this is Fatma, and at the moment Alana is on the camera. The current classification of ARDS uses the Berlin definition, an acute diffuse inflammatory lung injury leading to increased pulmonary vascular permeability, increased lung weight and loss of aerated lung tissue, with hypoxemia and bilateral radiographic opacities, associated with increased venous admixture, increased physiological dead space and decreased lung compliance. But because we are second year nursing students, we accept the simpler definition that we developed ourselves. ARDS is an inflammatory lung condition which decreases the lung's ability to hold and transfer oxygen, appropriately conduct blood oxygenation, and increases capillary permeability, causing edema in the alveolar space. Now, Emily and Fatma will do an in-depth nursing handover.
Emily, this is our patient, Miss Daisy Watt. She's 35 years old. She's been admitted in 29 May with RTA under influence of alcohol. She was admitted in short stay unit with deep laceration to the anterior aspect of the arm and the slight laceration to the anterior aspect of the thigh and chest trauma. She reported shortness of breath. Saturation was dropped to 91 with tachypnea. So O2 was started there, 2 liter. Chest X-ray taken there. It was showing oblique area of across pulmonary spaces and pulmonary edema. She was diagnosed with ARDS and shifted to ICU. In ICU, they ventilated with ET size 7, 6 and 10 centimeter with PIP 20 by 5, rate was 20, FiO2 85 and PEEP 7. Her vitals was 115/70, temperature was 38.7, saturation was showing 94 with this setting. She kept on medication, dextromethorphan infusion 1 mic per kg per minute, dopamine infusion 5 mic per kg per minute, tazocine antibiotic 4.5 IV every 8 hourly they were giving, and ibuprofen also 10 mg.
The surgical history of Daisy Watts was nil. Medical history: in 1988, she experienced near drowning, but luckily the lifeguards managed to resuscitate her. But she was admitted for 2 days for observation. In 2002, she was diagnosed with generalized anxiety disorder and was prescribed buspirone, but was discontinued after 3 weeks because of drowsiness. Allergies was nil. Social history: she had 3 to 5 glasses of wine per day. She is a pack-a-day smoker and uses marijuana because she believed that it reduces anxiety. Family history: her mother is still well and alive, 54. Father deceased with surgical complications. No brothers and sisters, but has a family history of type 2 diabetes.
Before we go on to our patient, we'll just go into some pathophysiology of acute respiratory distress syndrome. In normal lungs without damage or trauma, they are able to efficiently process gas exchange between the blood and cells of the body. During inspiration, air is taken into the body, down nasal cavities, through the pharynx and trachea before being processed into the bronchi and bronchioles and finally into the alveoli for gas exchange. The alveoli inflate during inhalation and deflate with expiration. A protein called surfactant helps maintain the surface tension of the alveoli to stop them from overinflating or collapsing during respiration. Oxygen diffuses out of the alveoli through the thin endothelium of the adjacent capillaries and into the blood for circulation into the body. Carbon dioxide moves out into the alveoli for expiration. In Mrs. Watt's condition, her lungs have become damaged from her car accident, near drowning, as well as her smoking habits. This will decrease the ability of the alveoli to carry out gas exchange. The damage to the alveoli and the lung endothelium will trigger an inflammatory response in her lungs. The inflammatory response will cause increased vascular permeability of the capillaries adjacent to the alveoli. This will cause an impaired removal of fluid from the alveolar space, resulting in pulmonary edema. This results in flooding of the alveoli with fluids, which will decrease lung compliance, which will cause Ms. Watts to have an increased work of breathing. Inflammatory mediators such as cytokines and neutrophils, which are activated as part of the inflammation, can release cytotoxic molecules, causing tissue necrosis and apoptosis. The death of these lung tissue cells is part of a etiology of her hypoxia and difficulty breathing. Ms. Watts' lung damage and damage caused by her inflammatory response will also cause poor gas exchange and manifesting in her hypoxia and shortness of breath. ARDS has a relatively high mortality rate, with around 30 to 40% of patients not surviving. If Ms. Watts' symptoms are not managed properly, it can manifest further into ventilatory-associated pneumonia or multiple organ disease, which significantly decreases her likelihood of survival and recovery without functional.
We will now go through Ms. Watts' medications. In accordance to NSQHS Standard 4 Medication Safety, it is important to remember the 7 drug rights. Right patient, right drug, right dose, right route, right time, right reason, and right documentation. The first drug on the list is
dexmedetomidine,
and the indication for the use of
dexmedetomidine,
is that it is used in intensive care settings for light to moderate sedation. The contraindications of
dexmedetomidine
is caution in elderly patients, patient with hepatic impairments, if patient is having bradycardia, patient with 2nd or 3rd degree AV block and hypertension, if patient has had severe ventricular dysfunction or sinus syndrome, patients with hypervolemia or patients with diabetes mellitus. The side effects of
dexmedetomidine,
bradycardia and hypertension, and the safety monitoring includes close monitoring of blood pressure and close cardiac monitoring in general.
Now we are going to move the second medication, which is
Tazocin.
Tazocin used to treat bacterial infection, such as those affecting lower respiratory tract, urinary tract, abdomen, skin, or blood. The contraindication for Tazocin, being allergic to piperacillin and tazobactam, or any other ingredient of this medication. Allergic to antibiotics such as penicillin. The side effect of Tazocin: serious skin rashes, shortness of breath, decrease in platelet and blood cell, prolonged blood clotting time, abnormal lab test, decrease in the blood protein, headache, sleeplessness, abdomen pain, abnormal kidney blood test, fever. The safety monitoring for Tazocin are evaluate blood chemistry and full blood count after and before the treatment, monitoring coagulation profile, do not administer this medication with other medication in the same site, and monitor for any skin rashes or allergic reaction noted.
The third medication is
ibuprofen,
the indication for this medication is primarily fever and mild to moderate pain. Contraindications for this medication is hypersensitivity to aspirin or another non-steroidal anti-inflammatory agent. Side effects of this medication include nausea, diarrhea, constipation, gastrointestinal ulceration, or bleeding. Safety monitoring includes the patient who have abnormal liver tests or who have developed signs and symptoms of liver dysfunction should be evaluated for hepatic dysfunction. If liver disease develops or systemic manifestations occur, this drug should be discontinued, and we have to closely monitor the renal functions. The fourth medication is
dopamine,
the indication for this medication include treating shock and low blood pressure due to heart attack, trauma, infection, or surgery, and maybe other causes as well. It is also to improve heart function when it is unable to pump enough blood. Dopamine is a vasopressor and inotropic agent. It works by increasing the pumping strength of the heart and the kidney blood supply. Contraindications for this medication include allergies to any ingredients to dopamine and whether the patient is on troxidopa or have taken furazodone or monoamine oxidase inhibitors within the past 21 days, adrenal gland tumors, or an uncorrected irregular heartbeat. Side effects to this medication include chest pain, fast, slow, or pounding heartbeats, as well as weakness, confusion, and swelling of the feet and ankles. Safety monitoring of this medication includes the respiratory rate as some of these products contain sulfites, which causes allergic reactions. Lab tests must be done, including urine output, heart function, blood pressure, and thyroid tests.